If you are getting treated for upper cervical instability, this one really matters. So, we need to create expectations if we are going to go through a recovery of upper cervical instability. If we don't create expectations, what happens so commonly is that patients become impatient, frustrated, and often discouraged. If we do create expectations, patients then often are much more patient, realistic, and hopeful. It doesn't mean it doesn't have to be frustrating. It can sometimes be frustrating, but most of the times if we can align our expectations with what is realistic, then it can be a much better process. So the first thing I always cover with patients is you got to be realistic. You have likely had this for quite some time and it does not get fixed overnight. We have to align with what is going on, which leads me into the next point, which it's a neurological condition. It is not like a strained muscle. You go for a massage and it gets better. It is not going to go like that. This is a neurological degenerative condition, especially if you have had it for a long time, some people up to decades. So we have to understand that if we're being realistic, well, that's been there quite some time. The next point is every case is different. I always like to say that no two cases are the same, so everybody's going to go through it differently. That means a different history, the recovery is going to look different, the timelines of that recovery, and emotions. Other people have had physical traumas along with it. There have been so many things that have happened with somebody's history and the emotions that they have had going along with that. So of course every case is going to be different. Now here's another one. See this little line? Now you can see that the trajectory is improving, but there are ups and downs, and you have to expect ups and downs. If we do not expect ups and downs, we are not being realistic. Okay, we have to expect the expectations, expect the ups and downs. It is going to go in this direction. As long as we start here and we are getting up here, that is great. But we have to know there are going to be some ups and downs along the way. And the last thing I want to say here is recovery takes longer than you think. Now, we don't want to get discouraged and say, oh gosh, it's going to take years. Yes, real improvements, if it's been there decades, can improve significantly with 1 year increments. But I'm not saying it's going to take a year. Oftentimes patients can feel better in weeks, normally months, but it is going to take longer than you think, and you have to be realistic and wrap your head around that. Okay, so what is my job in this process? So this is what I do. I get the patient stabilized, so my job is stabilization and often reassurance alongside that, because it doesn't happen overnight, and we have to know, is this process and the symptoms and experience that somebody's going through, is that normal? But stabilization is definitely my job alongside the reassurance. It's kind of both of those, but not emotional support. I am not trained in it. I am not equipped to doing that. Reassurance is not the same as emotional support, and I need people to understand this, that I am not equipped here. You need somebody else for this part. I can give you a lot of reassurance to say, yes, no, it's all good. This is a normal process and we're on the right track, but we have to watch out for this. So this is my job when it comes to stabilization. My job is to make sure that we get whatever joint and issue is going on. So specifically when we talk about upper cervical instability, we're going to talk about the ligaments. We're going to stabilize the joint because we are going to improve the way that ligaments hold that joint. And then in doing so, we are going to take pressure off the nerves. This is my job as a nerve guy, but specifically with upper cervical instability and correction is my job is initially to stabilize and therefore take the pressure off the nerves. That is the initial. And then nerves heal. But that happens over time. I'm not going to control this. I have to do this so then this can happen. I have to take the pressure off the nerves so then the nerves can heal. But that is the stepwise process that you're going to see. Now, what does the nerve healing look like? Well, the nerves will improve function. The nerve signals get stronger. The intensity will calm down. So that's what we say. We desensitize. And in general, the nerves will calm. Because oftentimes with upper cervical instability, we see some sympathetic dominance. So we want that to calm down. We want greater harmony with the whole system. And this is how we develop expectations for the recovery of upper cervical instability.